Hi, my name is Marla Mulvaney. I'm a dental hygienist, a burst ambassador, and a triple negative breast cancer survivor. I have been cancer-free for 3 years. I was diagnosed in January of 2017. I underwent a lumpectomy, first a biopsy, then a lumpectomy with a lymph node removal, a port placed, 4 rounds of chemo, and approximately 34 rounds of full breast radiation. I was finished with my treatment in the summer of 2017, and then I had to try to find a job, return to work. In January of 2018, I was scrolling through Facebook and I found Burst. I needed a toothbrush anyways, and so I decided to try it. And I loved it, and ever since then, I've been a Burst ambassador. The most important thing I learned during my battle with cancer was that I needed to get rid of negativity in my life, that I needed to move towards the positive and away from the negative, whether it be people or activities. I learned that love is a verb. I learned who my real friends are. I wanted to tell my story in hopes that it would help someone who's going through cancer or help someone get diagnosed with their cancer earlier, and so their treatment would be less severe. Also, I think it's very important that you take care of your oral health, especially when you're going through cancer treatment. I chose to go ahead and get my professional cleanings done and try to have the highest oral hygiene possible. Unfortunately, I didn't have Burst at the time, and so I had to stop using the toothbrush I was using because it was too harsh, and I had to start using an extra soft manual brush, an alcohol-free mouthwash, and sometimes warm salt water and other mouth rinses. I also use some dry mouth lozenges and my dental floss, and it was very important to keep my gums healthy to help keep my overall body in a healing mode. One of my Peak sisters has actually purchased a Burst, and she has metastatic breast cancer, and she says that it is so gentle she can use it even on her very sensitive gums. So as a dental hygienist, I think that you can positively affect cancer patients' lives and also positively affect your patients' lives by asking them if they're 40 or over, if they've had their yearly mammogram. It's a good reminder that our body and our mouth are connected and that we need to keep everything as healthy as possible. So that's something you can do to help people, just to be reminded when they come in for their dental cleaning. If they come in every 6 months, they should have had the mammogram about every other time. So that's always good to note, maybe when you're going over their medical histories. So I just want to say thank you to Burst for supporting breast cancer research and helping women and men with breast cancer in their lives. I also wanted to say that one of the hardest things about having breast cancer was actually losing my hair. And something I learned is that my beauty is not in my hair. My beauty is inside. And I actually used to have straight hair, and now I have curly hair, and it's darker, and I actually love it. But if you're struggling with how you look on the outside, really, you need to look on the inside. And the other thing I wanted to say is that I realized this last week, actually, as I meditated, as I swam my laps, that I missed swimming so much in that year. And that I'm so glad I can get back to it, because the doctors told me I couldn't swim. I couldn't swim during radiation. I couldn't chance being around people. It was almost like the pandemic, but I was sick and nobody was wearing masks. So I just kind of had to stay away, and I was very secretive. So I wanted to get my story out now because I wanted to remind people that early detection is so important. Getting the mammograms, doing their exams. My cancer couldn't be felt by any doctors. The tumor was really deep against my chest wall, and the only way it was detected was with a mammogram. And although I don't really care for the radiation that mammograms give us, and there's other alternatives such as thermography that you can look into, but if you're concerned about the radiation, definitely look into those alternatives, as well as your vitamin intake and your nutrition and your activity and just moderation. Alcohol, moderation, 30 minutes of activity a day. All these things really help add up to lowering your stress and decreasing your chances of breast cancer and other cancers. Thank you.